You guys are dispatched out to rendezvous with a private vehicle.
We're going to be running our paramedics through a pediatric simulation.
And did you get a sugar gas?
It allows our medics to see a really sick patient in a safe environment where they can learn and practice their skills that maybe they don't get to utilize as frequently as they do on an everyday call.
You might have to amp it up on them.
You have to be great when it matters, and so for us, having these situations where you can make mistakes, and it doesn't have the ramifications maybe that it has in the field, but also as a crew, you help each other to improve, and I said you're putting yourself in uneasy situations so that when you are in those situations in the field, your stress level is down.
So at like a 20 beat dip, and
they're high severity, low frequency. So what that means is they're the calls with the most severe, the most dire implications, and the events that we don't see too often. We always say that the more we see it, the faster we'll recognize it when it actually happens. And these real-time scenarios help cue us in on those.
I might sit them up a little bit.
Yeah.
Okay. Flatten the lungs a little less.
They look forward to coming in and doing these sessions, and I very frequently hear that they had a call a day or a week later that emulated what they learned here, and they were able to put it into practice.
Just how did the sim feel?
For us, that learning and kind of constant collaboration has helped us tremendously in the field and just puts us at ease where we know really what goals we're trying to attain.
Our medics and our EMTs have done an amazing job of being even more on the front lines. A lot of times in the emergency department and in the hospital, we know if a patient has COVID. These people are our medics are entering people's homes with no knowledge of their COVID status or their risk, and they do it willingly and with a smile on their face.
Between the public health orders and guidance from the CDC, there's always a little bit of a gray area where we need to consult and make sure that we're doing the right things, and the UW has been great for that. Whenever I've needed to talk with Dr. Gussick or any of the UW staff about, hey, is this best practice right now? Are we doing what you're doing? As providers in the field, are we doing the right thing? And they're always there to, give us guidance with best practices in the field. And yeah, it's been great having them as a resource through the pandemic that really challenged us.